Welcome. Hundreds of millions of people will get tinnitus sometime in their life, to different degrees. But when you're living with tinnitus, or that roaring, high-pitched sound that you may be feeling, I understand. This can cause anxiety, difficulty sleeping, and a lot of depression. So let me help you get rid of your tinnitus by using these specific techniques. We're going to stimulate neurosensory changes to the brain. And this is going to allow your tinnitus to calm down. What's beautiful about these techniques, it's safe, and you can do this at any time, in any place. And it is commonly known worldwide that tinnitus comes from our cochlea hair cells. When they're not functioning correctly, it travels through the auditory nerve to our brain. And if those hair cells are not functioning, obviously our brain is not reading our inner ear correctly, which causes that hissing or that humming or that high-pitched sound. But tinnitus can come from many other factors as well. Tinnitus can come from imbalance of pressure in the eustachian tubes that will affect the middle ear, because the middle ear communicates with the inner ear, which then communicates with the brain. It can actually be affected from the outer ear, from the lack of communication of vibration or transmission of sound into the ear in itself. So this technique is going to be a combination of percussion, tappement, pressure to help the communication with the inner ear and the brain. So let's get right into it. We're going to focus with the mastoid process. The mastoid process are these two bones right on the lower part of your ear. They're really hard bones, but what's interesting about these mastoid processes is that the sternocleidomastoid, the SCM muscles, when you turn your head to one side, you see that muscle pop out as well as the other side. Well, these muscles attach to the mastoid process. It's commonly seen that when we're under lots of stress, or even if we have forward head posture, when these SCM muscles are extremely tight, this has an effect with our ears and our neurological system that can cause that tinnitus or that ringing of the ears. So what you can do first is you can actually turn your head to one side. You'll feel the muscle come out. You'll take your knuckles and you'll just dig it into the SCM and lean over. Okay, it'll be real tender, that big muscle that comes out. And just apply pressure. And just do that for about 30 seconds. You'll do that on both sides. Then what I'd like you to do is take your fingertips on the mastoid process, which is the hard bone right here, and you're going to tap it. And just percuss on it and tap it. And by doing so, we're sending vibration into the ear as well as to the brain. And this, many times in itself, it can definitely calm down that tinnitus. Just do that for about 30 seconds. Now, what I'd like you to do is take your second and third fingers and go on the inside and the outside of the ear, like this. The middle finger will be on the inside, on the facial side. The second finger, will be on the outside. Okay, second and third on this side. And just going to go up and down and stimulate both sides of the ear. And do that for about 30 seconds. And by doing so, you're building up heat, you're building up friction, and you're going to hear that noise as you send that vibration into the inner ear, middle inner ear, and then to the brain. And after that, relax. And you'll feel immediate changes right after that. So that is a good sign. Now with tinnitus, as long as we get change, that's called progress. And if your symptoms don't totally go away right away, you need to continue these techniques. So let's proceed. The next technique we're going to do is that we are going to take our thumb and our second finger, and we're going to grab the upper part of our ear right like this. Just grab it. I just want you to pinch along the outside of the ear all the way down. Now, just go up and down and do that for about 30 seconds. And after that, I want you to concentrate on the flap of your ear, your lower earlobe. And these lower earlobes carry the master sensorial point that works directly with your ears. So you're going to take these thumb and second finger, and you're going to pinch. Just keep pinching for another 30 seconds, the whole entire lower earlobe. Just keep pinching. Okay? Very, very powerful. And this is something I like you to do throughout the day, right here. Particularly this right here. Just pinch the lower lobes because there's a direct correlation with these points. These auricular points with the inner ear as well as the brain. This is very, very powerful. The other thing I'd like you to do now, I'd like you to take your thumb and your second finger and grab your ear. And I'd like you to pull it out. Just pull it out. And while pulling it out, I'd like you to take your other hand, pinch your nose, close your mouth, and do little puffs. You're going to hear a little popping, but puff lightly. This is what it's going to be like. Do a few little puffs. You'll feel your ears pop, or sometimes they'll open up. You'll do that for about 10-15 seconds on that side. Then you'll take the other ear, pull it straight out as we open that area to help stimulate it, even to help hopefully allow those eustachian tubes to drain. Take your other two fingers, thumb and second finger, grab your nose, small little puffs, and do that for about 15 seconds as well. And if your ears stay clogged, just open your mouth like you're yawning, and they will unclog. This will actually help the eustachian tubes, which are the tubes that go behind the sinus area, behind the nasal area, to the middle area, to the middle ear, that is. And when these areas open and it's draining, you'll actually feel sinuses open up. This is really going to help your ears as well, because if you suffer with chronic sinusitis, allergies, that's going to clog up your eustachian tubes, which is going to affect the middle ear, which will affect the inner ear, which will affect the communication between the inner ear and the brain, which obviously can make your tinnitus much worse. Now, the other thing that's very common with tinnitus, you might have seen a lot of the people do this, but just tapping underneath the skull. I like to put my second finger over my middle finger like this. I'll turn around right under the skull, and you'll just kind of flick it down like this, okay? Just flick it down. You'll just do that flicking sensation. You hear that click, a little pop, and it sounds kind of loud, but that's a great way to stimulate those nerves in the ear as well as the brain. You can do that for a minute, minute and a half, and you can do that anytime as well. And that could be quite powerful. Immediately after, many of you may feel a tremendous amount of relief. But again, don't be disappointed if it doesn't go totally away, because this is something that you've had a long, long time. So this is something that you can continue to do, work on these little techniques, and you will definitely see lots of good changes. Now, another one of my favorite techniques that can really get a lot of stimulation inside the inner ear as well as stimulating the brain, is that we're going to use the palms of both hands, and we're just going to push it against our ears. And as we do it, we're closing our ears as we put pressure on there. But I want you to open your mouth as you do it. It's going to be like this. It's going to be like, so you're going to hear like a ba, ba. You're going to hear like a nice squishy, loud sound in your ears when you push in. But as you push in, open your mouth. Now, why do I ask you to open your mouth? Because every time you open your mouth, you're opening the eustachian tubes, allowing it to drain, allowing it to open. A lot of times people have chronic tinnitus. They've been through all these scans, all these doctors, and it can be as simple as problems in the eustachian tubes. And that can be very effective. So you'll do this, a good minute or so. You can do it slowly, but make sure you get that little popping sound and don't push too hard. That can really stimulate things to start getting you moving in the right direction. So let's review a few important things that I really think these things will help you. Number one, if you're eating lots of salty foods, MSG, if you're eating too much refined processed foods, that can definitely affect your tinnitus. Why? Because that's all directly related to inflammation. Inflammation is one of the key denominators in all problems and diseases in our body. The other thing is you must get enough sleep, cut down on the anxiety, start doing more meditation, deep breathing exercises, yoga, or even regular exercises around the house. Just walking, building up your endorphins can really make a huge change as well. So cutting that anxiety, as I said, that stress is really something that will help you as you cut down on that cortisol level. And eat those fruits and vegetables, those carotenoids, great natural anti-inflammatories, natural antioxidants, Your omega-3 fatty acids are extremely important. Try to cut down on too much omega-6s. That can cause a lot of inflammation as well. Your bromelain, your quercetin, your turmeric, those are excellent. And, one of the most important things is make sure you're drinking lots of water. Remember, if you are toxic, that can be an indication that can cause this condition as well. And gut health is extremely important. Make sure you're getting those fermented foods and the good probiotics in your gut, as well as feeding those probiotics with the prebiotics, which are your fiber foods. So don't let tinnitus control you. You can control it by just doing the right things, really getting on a good lifestyle, making sure you're getting enough sleep, because that is extremely important when it comes to detoxification of our bodies as well as healing our cells. But try to keep your mind busy. Don't dwell on the issue. I like you to dwell on the solution, and that's taking good care of yourself in all the realms that we talked about today. I hope you enjoyed this video. Please share it with your friends and family, and most important, make it a great day. I'm Dr. Alan Mandell.